How is EUS used for pancreatic serous cystadenoma? Endoscopic ultrasound, often referred to as EUS, plays a crucial role in evaluating pancreatic serous cystadenomas. These are benign cystic tumors that can form in the pancreas. EUS provides high-resolution images that allow doctors to see the unique features of these cysts. For instance, serous cystadenomas typically display multiple small microcysts arranged in a honeycomb pattern. This imaging capability is essential for distinguishing serous cystadenomas from other pancreatic cysts, although the accuracy can depend on the operator's skill. During an EUS procedure, doctors may also perform fine needle aspiration. This involves using a thin needle to collect fluid from the cyst. Analyzing this fluid can provide valuable information, such as tumor markers and cytology, which helps improve the accuracy of the diagnosis. The combination of EUS and fine needle aspiration enhances the sensitivity and specificity of determining whether a cyst is benign, precancerous, or malignant. For serous cystadenomas, the fluid analysis usually shows low levels of carcinoembryonic antigen, which helps differentiate them from mucinous cystic lesions that tend to have higher levels of this marker. However, EUS does have its limitations. It may not always reliably distinguish serous cystadenomas from other cystic neoplasms that share similar features, such as macrocystic variants or mucinous cystic neoplasms. Misclassification could lead to unnecessary treatments, including surgery. Therefore, doctors interpret EUS findings alongside clinical presentations, other imaging techniques like computed tomography and magnetic resonance imaging, and the results from cyst fluid analysis. In clinical practice, EUS is used to provide detailed imaging of pancreatic cysts. This helps identify features that suggest a serous cystadenoma. It also guides fine needle aspiration to obtain cyst fluid for further analysis. Additionally, EUS assists in differentiating serous cystadenomas from other pancreatic lesions, especially mucinous cysts that carry a higher risk of cancer. It can also help monitor cysts over time when surgery is not immediately necessary, as serous cystadenomas are generally benign and grow slowly. Surgical intervention is usually reserved for cases where symptoms arise. The diagnosis remains uncertain after EUS and other evaluations, or there is a concern about cancer, which is rare for serous cystadenomas. Overall, EUS, especially when combined with fine needle aspiration, is a valuable and minimally invasive tool in diagnosing and managing pancreatic serous cystadenomas. It supports pancreas health by helping avoid unnecessary surgeries and enabling appropriate monitoring of these benign lesions. Always consult healthcare professionals for personalized medical advice regarding any concerns.